Weak, shaky legs after 60 aren't permanent. I'm a physical therapist, and I've helped hundreds of seniors go from grabbing railings and furniture to walking confidently again. It takes just 2 weeks if you do the right exercises. Today I'm showing you exactly which exercises fix which type of weakness. Pick the one that matches your symptoms and start today. Janet's legs started giving out during grocery shopping. She grabbed carts for support, avoided stairs, and felt terrified of falling. Her doctor said it was normal aging. But when a physical therapist identified the real cause, 3 specific exercises brought her strength back in 14 days. Today, I'm breaking down those exact movements and the 5 hidden reasons your legs feel weak. If your legs feel shaky, unstable, or like they might buckle under you, this video is for you. I'm going to show you 5 specific reasons why leg weakness happens after 60 and the exact exercises that fix each one. By the end of this video, you'll know which cause applies to you and what to do about it starting today. Medical disclaimer: this content is for educational purposes only. Always consult your healthcare provider before beginning any new exercise program, especially if you have existing medical conditions or balance issues. Let's start with reason number 1. General muscle weakness in your hips, quads, and glutes. This is the most common cause of leg weakness in seniors. What happens is simple. When muscles aren't used regularly, they atrophy. They literally shrink and lose strength. Maybe you retired and became less active. Maybe you had surgery and didn't complete rehab properly. Maybe you sit most of the day. Whatever the reason, when you don't use it, you lose it. This shows up as knees buckling, difficulty standing from a chair, or trouble walking distances. The good news? This type of weakness responds incredibly well to targeted exercises. Exercise 1. Sit to stands. This is essentially a squat, but most people master the form better when they think of it as standing up from a chair. Here's how to do it. Sit in a sturdy chair with your feet flat on the floor, hip-width apart. If you're very weak, start with a higher surface like a kitchen counter stool or use armrests for support. Cross your arms over your chest or hold them out in front. Lean forward slightly and push through your heels to stand up. Squeeze your glutes at the top. Shoulders back. Good posture. Then slowly lower back down with control. Don't just drop into the seat. The lowering phase is just as important as standing up. Start with what you can manage. If you can only do 3 to 5 repetitions with assistance, that's fine. If you can do 10 repetitions easily without using your hands, that's your goal. Do this 3 times throughout the day. Morning, afternoon, evening. As you get stronger, progress from using 2 hands to 1 hand to no hands. The goal is to stand up from a normal height chair without any hand support 10 times comfortably. When you can do that, you're ready for unlimited daily activities. Exercise 2. Glute bridges. If sit-to-stands are too difficult right now, start here. You can do this on your bed or on the floor. Lie on your back with knees bent and feet flat. Squeeze your glutes together and tighten your abdominal muscles. Lift your hips up toward the ceiling as high as you can. Hold for 3 to 5 seconds at the top. Then lower back down with control. If you're weaker, you may only lift a few inches. That's okay. Focus on the squeeze. This exercise strengthens your glutes, hamstrings, lower back, and core. Do 8 to 10 repetitions, 3 times per day. Exercise 3. Step-ups. This is the most challenging of the 3, but it's excellent if you struggle with stairs. Find a sturdy step with a railing. Start with 1 step. Place 1 foot on the step. Hold the railing for support. Push through your heel to step up. Bring your other foot up to meet it. Then step back down with control. Don't just fall backward. Control the descent. Do 5 to 10 repetitions on 1 leg, then switch to the other. If your home stairs are too high, use a step stool that's very sturdy. As you get stronger, try using only 1 hand on the railing. Then no hands. If 1 step becomes easy, progress to a higher step. But make sure you can control the movement down before progressing up. Reason number 2. Nerve problems. This could be coming from your lower back. You might have sciatica, a pinched nerve, or spinal stenosis. When nerves are compressed or irritated, the signal from your brain to your legs gets interrupted. This causes weakness and often numbness, tingling, or burning sensations down your leg. If you're experiencing these symptoms, gentle spinal mobility and nerve gliding exercises can help. But there's an important warning. If these exercises make your symptoms worse, stop immediately and see a doctor. Worsening nerve symptoms require professional evaluation. Exercise 1. Low trunk rotations. Lie on your back with knees bent and feet flat. Let your knees fall gently to one side. Only go as far as feels comfortable. Hold for a few seconds. Then bring them back to center and over to the other side. This gentle spinal movement can help reduce nerve irritation. Do 8 to 10 repetitions on each side. If this increases pain, numbness, or tingling down your leg, stop. This is your body telling you the nerve compression is too severe for self-treatment. Exercise 2. Seated sciatic nerve glides. Sit on a tall, firm surface like the edge of a bed or a high chair. Your knees should be able to straighten fully. Start with your head looking down and your knee bent. Then look up toward the ceiling while you straighten your knee and pull your toes up toward you. Then look back down as you bend your knee and point your toes. You're creating a gentle gliding motion of the nerve. Do this slowly 8 to 10 times. You should feel some unusual sensations, maybe tingling or mild pulling. If symptoms improve as you do it, that's good. If they get worse with every repetition, stop. The irritation is too aggressive for this exercise. Again, if you have progressive weakness, like difficulty lifting your toes or foot drop, see a doctor immediately. That's a sign of significant nerve compression that may require medical intervention. Reason number 3, joint wear and tear. After years of use, your hips, knees, and ankles can develop arthritis, cartilage damage, or general wear and tear. Joint pain automatically shuts down the muscles around that joint. Your nervous system does this as a protective mechanism. The problem is this creates a cycle. Pain causes weakness. Weakness causes instability. Instability causes more pain. The solution? Strengthen the muscles around the painful joint. Stronger muscles take pressure off the joint and improve stability. If you have joint pain, start with range of motion exercises. Just gently moving the joint without weight bearing. For knees, sit and straighten your leg out. Bend it back. Do this slowly 10 times. This activates the muscles and lubricates the joint. Then progress to sit to stands using your arms for assistance. The stronger your leg muscles become, the less pressure goes through your joints. Also consider non-weight bearing exercises like a stationary bike or a recumbent stepper machine. These allow you to build strength and endurance without pounding your joints. Start with short sessions, 5 to 10 minutes, and gradually increase as tolerated. Reason number 4, balance and proprioceptive issues. Proprioception is your body's ability to sense where it is in space. As we age or after joint replacements, or with conditions like neuropathy, this sense weakens. You feel unsteady. Your legs feel uncertain. You rely more on walkers or holding furniture. The only way to improve balance is to practice balance exercises safely. Exercise 1. Single leg standing. Stand near a corner or hold a sturdy countertop for support. Lift one foot slightly off the ground. Keep a slight bend in your standing knee. Hold this position. If you need support, use it. As you improve, try letting go with one hand, then both hands. The goal is to hold a single leg stand for 30 seconds. For most people over 60, 5 to 15 seconds is typical. Do this 3 to 4 times on each leg. If one leg is weaker, spend more time on that side. Exercise 2. Tandem stance. Place one foot directly in front of the other, heel to toe, like you're walking a tightrope but standing still. Hold on to support. If this is too difficult, start with feet slightly apart but still one in front of the other. Gradually bring them closer together as your balance improves. Hold for 15 to 30 seconds. Switch which foot is in front. Do this 3 to 4 times. This challenges your balance differently than single leg stance. Exercise 3. Weight shifting. If both of those seem too hard, start here. Stand with feet hip-width apart holding support. Shift all your weight onto your right leg. Your left toe can stay touching the ground, but your heel lifts. Hold for a few seconds. Then shift all your weight to your left leg. Just work on feeling stable as you transfer weight side to side. Do this 10 times each side. To make any of these harder as you improve, try standing on a large pillow, a foam pad, or a thick carpet. The unstable surface forces your ankle muscles to work harder and improves proprioception. Only do this if you have something sturdy to hold on to. Reason number 5. Poor overall endurance and circulation. Sometimes leg weakness isn't about strength or balance. It's about stamina. Your muscles fatigue quickly because your cardiovascular system isn't conditioned. Your circulation is poor. Your legs don't get enough oxygen-rich blood during activity. The solution is aerobic exercise. But start slow. If you haven't exercised in months or years, don't jump into 10-minute sessions. Start with 2 to 3 minutes. Do it multiple times throughout the day if needed. Use a recumbent bike, a seated pedal or stepper machine, or just walk in place. The key is sustained, gentle movement that elevates your heart rate slightly without exhausting you. Gradually increase duration over weeks. Add 1 minute every few days. Build up to 10, then 15, then 20 minutes. This improves circulation, builds muscular endurance, and trains your cardiovascular system. Your legs will feel stronger simply because they're getting better oxygen delivery and waste removal.
Here's the bottom line.
You likely have more than one of these 5 causes contributing to your leg weakness. The important thing is to practice what you're not good at. If balance is your weakness, do balance exercises daily. If strength is the issue, do strengthening exercises. If endurance is lacking, do aerobic activity. Improvement only comes from consistent practice. Your legs won't get stronger by avoiding the things that challenge them. Start today with just one exercise from the category that applies most to you. Do it for 2 weeks consistently. Then add another. Small, consistent efforts compound into major improvements. Your legs can get stronger. Your balance can improve. You don't have to accept weakness as inevitable. If this video helped you identify the cause of your leg weakness, drop a comment below and tell me which exercise you're starting with. Share this with someone over 60 who's struggling with weak or shaky legs. It could help them avoid a fall or regain their independence. And subscribe for more evidence-based exercises designed specifically for seniors. Medical disclaimer: this video is for educational purposes only and does not replace professional medical advice. Consult your physician before starting any exercise program.